Mayaki, Chief Executive Officer, AUDA NEPAD, Your Excellency Dr. Tedros Ghebreyesus, Director General of World Health Organization, Your Excellency Dr. Ngozi Okonjo-Iweala, Director General, World Trade Organization, Your Excellency Dr. Vera Songwe, UN Under Secretary General and Executive Secretary of UNECA, Your Excellency Dr. Akinui Adesina, President of the African Development Bank. May I also recognize the presence of Dr. John Kengasong, Director, Africa Center for Disease Control and Prevention. Distinguished guests, ladies and gentlemen, from the outset, it is my great pleasure to welcome you to this two-day conference on expanding Africa's vaccine manufacturing access to COVID-19 and to announce the chair and convener of the meeting, His Excellency Musa Faki Mahamat, Chairperson of the African Union Commission. May I now call upon Musa Faki Mahamat to remark. I'm now calling upon His Excellency Musa Faki Mahamat to make his welcome remarks.
Yeah. His Excellency was making the remarks, but he was muted. Can somebody please unmute His Excellency?
Excellence, Monsieur le Président de l'Union africaine.
Excellence, the Chair of the African Union, your heads of state in your various capacities. Permit me, first of all, to welcome you and to thank you very dearly for accepting to participate in this very important meeting on fighting COVID-19. The people in the world and in Africa and the issue of vaccination, which is the center point of this meeting. It is indeed very urgent, an urgency which is made even greater by the various variants in the world and especially in Africa. I would like to salute the setting up of mechanisms like COVAX, coordinated by the WHO, David, and CEPI. I would also like to congratulate partners, multilateral and bilateral partners. Ladies and gentlemen, the COVAX mechanism will be able to meet 20% of the continent's needs and
en Afrique subsaharienne, plus de 90%.
In sub-Saharan Africa, more than 90% of this is found in people of less than 60 years, and more than 80% of infections are asymptomatic. That means that the young people are reserves of the pandemic. Besides the 60% of vaccination, confinement is the only method to stop the virus. You know the devastating effects on economies which are essentially informal. Physical distancing is affected by our way of living on our continent. Education, online education is not very often available because of lack of technological development. So education will continue to be disturbed. This means that a number of cultural factors in Africa make it difficult to follow all the barrier measures. So on what pillar should our vaccine strategy rely on? Obviously, it should rely on the acceleration of Africa's participation in the clinical development of a vaccine. And the attention should be centered on multiplying efforts, continental and bilateral, to access vaccines. The elimination of obstacles to distribution and widespread use of vaccines in Africa should be another axis of a strategic commitment. The intensification of our commitments on the continent with our strategic partners for a new world health order, which will create a framework for innovation. I'd like on this note to insist on the African Agency for Medication, which we instituted. We ask all member states to sign and ratify this act. I have appointed the Minister Michel Sidibe as a special envoy to carry out advocacy for this. Another important aspect is the funding of public health that President Paul Kagame is a champion. I'd like to congratulate all the presidents and head of government, and also to thank the President Cyril Ramaphosa, who is championing the cause. I'd also like to thank the special representatives and our partners, especially the African Union, the World Bank, the FMI, and G20 for the efforts made to alleviate the deaths of African countries. Your Excellencies, ladies and gentlemen, the production of vaccine and access to vaccine is an absolute necessity for our continent. It is not possible, if we take into consideration the situation in Africa, to be able to overcome this if we do not insist on the implication of African institutions in the production, especially to fight African-specific pandemics, Ebola, Lassa fever, etc. It is also important to emphasize the rivalry in the production and availability of vaccines. Africa should be a priority, and this can only be possible with a substantial effort in Africa that we are encouraging. Thank you for your kind attention.
I thank His Excellency for his remarks. It is now my honor to call upon His Excellency Felix Tshisekedi, Chairperson of the African Union and President of the Democratic Republic of Congo, who will in turn invite the participating heads of state and government, as well as other speakers to make their remarks. Thank you.
Bonjour.
Good morning. The President is craving your indulgence for 10 minutes. If you can be patient for 10 minutes.
Bonjour.
Good morning.
Allô?
Hello.
D'accord.
The President is not available for the next 10 minutes. Should we wait or should we move on with the agenda?
It's better to move.
Yes, please. We will go ahead with His Excellency Cyril Ramaphosa, President of the Republic of South Africa, to make his remarks.
Chair of the African Union, His Excellency President Felix Tshisekedi, Chairperson of the African Union Commission, His Excellency Moussa Faki Mahamat, President of the Republic of Rwanda, His Excellency Paul Kagame, President of the Republic of Senegal, His Excellency Macky Sall, Director General of the World Health Organization, Dr. Tedros Ghebreyesus, Director General of the World Trade Organization, Dr. Ngozi Okonjo-Iweala, Director of the CDC, Dr. John Nkengasong, distinguished participants, ladies and gentlemen. This virtual conference is taking place at a critical moment in the struggle of our continent and the global community to overcome the COVID-19 pandemic. While the global rate of transmission continues to climb, millions of people across the world are being vaccinated every day. Despite concerns around new waves of infection and the emergence of new variants, the production of effective vaccines has provided hope for recovery for many. But not all countries can share equally in the hope of having access to vaccines at the time they need them most. The global disparities in wealth and capability to develop, to produce, and have access to vaccines is hampering efforts by middle and lower income countries to make vaccines available to their populations. The challenge that many African countries face is that the supply of vaccines is currently too slow to meet our needs. Our immediate task, therefore, is to secure sufficient vaccine doses for African countries through the African Vaccine Acquisition Task Team, which has made valuable progress through its engagement with vaccine manufacturers. This effort is supported by other initiatives to manufacture vaccines on the continent where possible under license and in collaboration with current developers and manufacturers. The Aspen facility in South Africa, for example, will make some 220 million doses available following the African Vaccine Acquisition Task Team's agreement with Johnson & Johnson. But that is only the beginning. Throughout this pandemic, Africa has demonstrated that it has extensive and substantial capabilities, as well as resources and skills to address the challenges that are given rise by the pandemic. Africa's response has shown the depth of scientific expertise on the continent and has provided an opportunity for unprecedented scientific collaboration. Through initiatives like the Africa Medical Supplies Platform, the continent has pioneered new ways of ensuring access to vital personal protective equipment, as well as diagnostics and therapeutics. Through our own continental institutions, we have mobilized substantial resources to support the health response to this pandemic by the continent. Importantly, the leaders of the continent have demonstrated the political will to act decisively in the face of this grave threat to health and well-being of the people of our continent. Our task now is to harness all these capabilities and to draw on the experience of the past year to build a vibrant and innovative African medical supplies manufacturing capability that meets the health needs of the continent's people. This means that in the medium term, we need to expand existing capabilities into regional hubs that serve the continent as a whole. To do this, Africa needs to harness its own continental capabilities and identify opportunities for collaboration across several countries on the continent. We also need to forge sustainable partnerships with entities in both the developed world as well as the developing world. Partners in various countries could offer technological expertise, financing, and investment. Countries such as India and Brazil could provide guidance on how they developed their own generic pharmaceutical industries. Such collaboration should form the basis of a longer-term strategy to develop a medical supplies industry that can achieve continental scale, taking advantage of the large, growing, and increasingly integrated African market. The private sector will be essential to the success of this effort. In addition to domestic government spending and regional financial commitments, the public and private sector will need to invest in such initiatives. We will also need capacity building in the form of skills and knowledge transfer to ensure that we can sustain local manufacturing on the continent. In ensuring an effective response to the current pandemic, we must strengthen our ability to both respond to future health emergencies and to achieve health security for the people of our continent. The vision of a strong African medical supplies and vaccine manufacturing capability that responds effectively to the health needs of the African people is bold and also ambitious, but it is achievable. From the experience of the past year, I am confident that Africa is closer now than ever before to the fulfillment of this vision. I thank you.
We thank His Excellency for his remarks. I now call upon His Excellency Paul Kagame, President of the Republic of Rwanda, to make his remark. Thank you.
Excellency, President Felix Tshisekedi, Chairperson of the African Union, Excellency President Cyril Ramaphosa, the African Union champion for COVID-19, Excellency President Macky Sall, Excellency Moussa Faki, Chairperson of the African Union, Dr. John Nkengasong, Director of African CDC, Madam Ngozi, Director General of WTO, distinguished ladies and gentlemen, WHO Director General Tedros. I want to begin by thanking the African Union Commission led by Chairperson Moussa and Africa CDC for convening this timely conference. Vaccine equity cannot be guaranteed by goodwill alone. as we have seen many examples to convince all of us. Africa needs to expand production capacity for vaccines and other essential medical products. I can't agree more with President Cyril Ramaphosa. In line with our agenda of increasing domestic health financing, it is important for Africa to forge strategic public-private partnerships for vaccine manufacturing on our continent. Let me add here, Excellencies, that in the past few weeks and maybe months, I had the opportunity to initiate contacts with different manufacturers of vaccines, specifically focusing on the messenger RNA technique used, say, by Moderna and Pfizer. And but the whole idea is now how we can also have this type of capability on our continent, which really complements other ways like the adenovirus method, vaccines used by Johnson & Johnson, AstraZeneca, and also South Africa. In Aspen, they have that capability, but I think the future also is about the messenger RNA, and I think in the audience there are people even better informed than myself, but I think complementarity is better achieved and if we focus on that. And therefore, for Africa, move from being really very sorry for ourselves, which is the case today, and I think no one, maybe single person takes the blame for that, but we have to overcome that and move from what we know has not worked for us, for Africa well, to something we can do and we are able to do, given a few examples, again, President Ramaphosa mentioned, by partnering with these industries. So, President, I say the African Continental Free Trade Area makes these investments even more attractive. The African Medicines Agency Treaty is also a critical part of the institutional framework, and I urge African member states to ratify this, as many as we can have ratify as soon as possible. I also commend Chairperson Musa for naming a special envoy for the African Medicines Agency, Dr. Michel Sidibe. Goes hand in hand with increased investments in domestic health systems, as well as building an efficient and autonomous African CDC, which I think is the way we are headed. Rwanda is ready to play a role in this effort, together with other member states and partners. And on this note, I thank you very much for your kind attention.
I have the feeling